skin. Alternatively, you may slide the wrist strap up your forearm further to put more stretch on the strap and apply more pressure to the contact plate. Alternatively, in extremely dry skins, you may find it better to hold the contact plate between your finger and your thumb. In extreme cases, place a small moist pad between the plate and the wrist. This may make it easier to locate points then. All of these are probably going to be unnecessary, and they only apply for very dry, resistant skins. If all of these fail, it may indicate a break in the probe wire, as described later. Now, having located the point, press the treatment timer button once and release. This may be pressed with the tip of the finger, or if you are treating a finger on the other hand and find it awkward, since the treatment timer button is the only press switch on the front of the dial, if you press the whole of the side of your hand along the dial, you'll find that will press the treatment timer as well. After this has been pressed, the light will flash. Next, turn the intensity button clockwise until the treatment pulse is felt firmly but not uncomfortably. At the end of 45 seconds, treatment will stop, and either press that button again to repeat that treatment if you wish to give it another time, or move to the next point as indicated by the book. Treatments can be repeated up to 3 times a day, reducing the intervals as improvement occurs. Test your battery every month or so, or sooner if the treatment strength weakens or point finding becomes difficult. Now, just a few helpful hints. The wire to the probe threads down through the handle of the probe, then through a small hole at the bottom to wind around the metal part. It is held in place by a small silver ferrule wound up around it. It is wise to test this ferrule every week or so to ensure it is still tight. If it loosens, the wire may be pulled out of the probe, or the ferrule may completely unwind and you may lose it. Should this happen, it is a simple means to replace the wire and the ferrule. The main thing to do then is to take the wire, thread it down through the probe, push it so that it comes out of the small hole at the bottom, then wind it around the metal part, screw the ferrule on firmly. Now, undue tension on the probe wire or compressing it when closing the slide cover may result in a break of the wire. In this case, the probe will not locate points. To test if your wire is broken, slide the back slide cover down, remove the small plug exposing the 2 small thin metal prongs, switch the unit on, short across the prongs with the metal probe tip. Now, if the light goes out, then you know the fault is in the wire and there's no problem in the unit. If you have any problems with your AcuPlus, contact your distributor with any queries and he may have a simple answer for you. Or ask about other devices developed by SHP International for weight loss, quit smoking, tranquilizer addiction, stress and insomnia. The AcuQuit has been developed for treatment of any addiction, whether it be smoking, tranquilizers or drugs. It is a simple method for frequent home treatment of acupuncture points in the ear, which have been recognised as being effective in controlling the withdrawal effects of addictive substances. The simple controls are an on-off slide switch and an intensity control. The battery compartment and cord winder are identical to the stress man on the same video. Use your instructions to follow the points shown on this video. 2 acupuncture points on the ear are to be treated. Read paragraph 5 and 8 of the instructions to locate points A and B. Point B is shown on the stress man section of this video and described in instructions paragraph 8. Point A is described in instructions paragraph 5 as being in the deepest part of the large hollow at the lower part of the ear. Point A is now shown marked in black. Point B is now shown marked in black. Wipe this point with a damp cloth or alco swab and dry thoroughly. Slide the winder cover down on the unit and unwind the leads fully. Take the bottle of adhesive conductive gel, squeeze approximately 1 millimetre of gel onto a fingertip, smear it over the area of point A, then smear any left on the finger over the metal surface of the square electrode. Allow this to dry for 2 minutes. Wipe excess from the finger with a damp cloth. Then remove a sheet of disposable electrode pads from the clip lock bag. Then, bending the sheet a little at the middle, raise the square end of one electrode pad off the backing paper sufficiently to slide the square metal electrode silver side up under the square end. Press the square end onto the silver surface, then holding the pad and the metal electrode between finger and thumb, peel the electrode off the sheet. At all times, keep unused pads sealed in a clip lock bag. A spare bag is in the pouch to enable you to carry a few sheets of pads at a time. Until adept at placement, it is wise to use a mirror to place the round end of the pad over point A, pressing on to point A, then giving a good press between finger in front and thumb behind the ear over the pad. This should ensure adequate adhesion of the pad to point A. Either ear may be used, but it is wise to alternate ears occasionally. Next, take the black ear clip. The small black tab may be pushed through either side of the rubber ring, depending which side you wish to use. Holding this tab between finger and thumb on the appropriate side for the ear to be used, move the long thin arm of the clip over the top of the ear until the gold electrode is positioned just in front of the upper part of the ear. Keeping the clip parallel to the side of the face, pull the clip downward, slightly backward and then upward, so the gold electrode is pulled over the front fold of the ear, then up to cover point B, which is in the triangular shaped depression at the upper front part of the ear, partly covered by the flap of the rim of the ear. Next, push the rubber ring into the large hollow at the lower part of the ear. It is usually easier to push the bottom part in first, then the rest. Now take the AcuQuit unit, switch it on by sliding the lower switch upward. If the red light does not come on, it may mean flat batteries, or the batteries are incorrectly inserted, or poor contact. Rolling the batteries may improve this contact. Next, turn the dial at the top clockwise until you feel the pulse beat at about 2 per second. Adjust it up or down to a comfortable pulse level. There is no need for the pulse to be uncomfortably strong, just at a comfortable level. The strength may require adjustment during treatment. The unit may then be placed in a pocket or on a chair while you proceed with your normal activities. The electrode pads are disposable, so at the end of treatment, remove the ear clip by pulling it forward off the ear, pull the electrode pad off, remove the pad from the square electrode, discard this pad and wipe any residue off the silver surface with a damp cloth. The electrode gel is water soluble, so may be wiped from the ear with a damp cloth. It is suggested that the AcuQuit be used initially 2 or 3 times a day or more when you are in danger of having a cigarette, reducing treatments as you feel you are gaining control. The most common reasons for any difficulty or lack of results have been inadequate attention to cleaning the waxy film from point A and drying thoroughly, applying too much gel and or not allowing sufficient time for the gel to dry. Sometimes it does take 2 minutes to get tack free so that the electrode adheres well. Sometimes, if insufficient drying time is given to point A or not applying some gel to the silver electrode, there may be insufficient adhesion at these points. Some may find they do not need gel, but it assists both adhesion and conduction. Not applying the round end of the electrode pad accurately over the area of point A will also cause insufficient stimulation. There is a fair amount of latitude allowed in placement at this point, and as long as part of this electrode covers point A, it will be satisfactory. Twisting the electrode pad while fixing the ear clip in place, and this may interfere with the conduction path along the adhesive electrode. If you practice initially in front of a mirror with both placement of the disposable electrode on point A and insertion of the ear clip and placing the rubber ring in the hollow, then in no time you should become quite adept at both these procedures. Trials have shown that where the AcuQuit is used strictly in accordance with instructions and you are serious about quitting, it is effective in quitting a variety of addictive substances. It is most effective when you stop smoking and let the AcuQuit take care of your withdrawal effects. The Stress Man provides a simple method of stimulating the relaxing point Shenman in the ear for relaxation, stress reduction and improving sleep patterns. The various controls are from below upward: the on-off switch, the battery test light, the waveform control, the pause switch and the intensity dial. The battery test light, waveform control and pause switch are unnecessary refinements and to contain costs will at some future date be left out. At the rear is the battery compartment and the slide cover, behind which is the ear clip electrode. Remove the battery cover by pushing the clip towards the bottom of the unit. Insert the batteries in the order shown on the rear of the compartment, then replace the cover. By gripping the slide cover on the finger grips, move the slide cover downward, remove the black ear clip and fully unwind the wire. Slide the cover back, ensuring the wire exits through one of the cutout slots. The parts of the ear clip are the long arm which fits over the top of the ear, the small black tab which pushes to either side depending which ear is to be used, the gold electrode which covers the ear point Shenman, and the rubber ring which fits into the hollow at the lower part of the ear to hold the clip in place. Next, take the black ear clip. The small black tab may be pushed through either side of the rubber ring, depending which side you wish to use. Holding this tab between finger and thumb on the appropriate side for the ear to be used, move the long thin arm of the clip over the top of the ear until the gold electrode is positioned just in front of the upper part of the ear. Keeping the clip parallel to the side of the face, pull the clip downward, slightly backward and then upward, so the gold electrode is pulled over the front fold of the ear, then up to cover point B. which is in the triangular-shaped depression at the upper front part of the ear, partly covered by the flap of the rim of the ear. Next, push the rubber ring into the large hollow at the lower part of the ear. It is usually easier to push the bottom part in first